Welcome to Medico Crazy, guys. So in this video we are gonna talk about a very important vitamin, that is vitamin A. We are gonna cover everything which you need to know as a medical student for vitamin A. We are gonna cover the introductional part, the chemistry, biochemistry of the vitamin A, the sources from which we can get vitamin A, the metabolism of vitamin A, deficiency of vitamin A, and also the hypervitaminosis and the symptoms of the deficiency and the treatment, and what are the supplements and in how much supplement we need to give to the patients. So let's start with the introductional part. Vitamin A, it is a group of unsaturated nutritional organic compound. It's a group of unsaturated nutritional organic compound that includes retinol. It includes three things, that is retinol, retinol, and several provitamin A, that is carotenoids, mostly the beta carotene. So this is the introductional part, the definition of vitamin A. So the vitamin A, in biochemistry we have three structures of vitamin A. So these three structures are alcohol, aldehyde, and carboxylic acid. The first one is retinol, that is alcohol, where R is CH2OH. Then retinol, aldehyde, where R is CHO. And retinic acid, that is carboxylic acid, where R is COOH. So these three things, the retinol, and retinoic acid together, these are called retinoids. These retinoids have a beta anion ring and all the trans with 4 double bonds. All trans with 4 double bonds, and they have a limited stability. So three structures: retinol, retinol, and retinoic acid. So there are two types of vitamin A. Generally we classify vitamin A in two types, the pro and the preformed. So the pro vitamin A and the preformed vitamin A. Pro vitamin A and preformed vitamin A, two types of vitamin A. So if we talk about the pro vitamin A, they are mainly from we obtain these mainly from plant sources, and these are known as carotenoids. And the preformed vitamin A obtained from animal sources, and these are known as retinoids. So carotenoids from the plant sources, retinoids from the animal sources. So carotene we have in three forms, that is alpha, beta, and gamma. This is the provitamin, and after the activation of carotene by dioxygenase or reductase, it gives us an active form of vitamin A. So carotene is a provitamin which gives an active form of vitamin A, which is called retinoid. So the active form of vitamin A is retinoid. So let's talk about the sources from which we can get vitamin A. So basically we have three sources from which we can get vitamin A: is animal source, plant source, and artificial. Artificial is just the supplements. So let's consider plant sources. So what are the plant sources from which we can get the mostly we get it from the carrot, green leafy vegetables, also from the mango, papaya, and pumpkin. But the carrot is a major source. From the plant sources, the carrot is the main. And then if we talk about the animal sources, we have egg, liver, cheese, and also some other milk products from which we can get vitamin A. And artificial, as I already told you, these are the supplements. So let's talk about a term RDA, that is required daily allowance. So how much vitamin A is required on a daily basis? This is RDA, required daily allowance, which is approximately 3000 international unit in a normal blood volume of 18 to 16 microgram per DL. But if I specifically talk about RD in a specific age groups, if I will talk about how much required daily allowance in a different age groups, so let's consider firstly about the children from 1 to 6 years of the age group. They need 400 micrograms per day. And if we talk about a men or women, if we talk about an adult, the requirement is 600 mg microgram per DL. And if we talk about a pregnant woman in pregnancy, the requirement is about 800 microgram per day. and in lactational period we need the maximum, that is 950 microgram per day. So let's talk about the functions of vitamin A. So vitamin A has a very vital and essential functions in our body. So the number one and a very important is vision, especially at the night vision, because of the rhodopsin which is present in rod cells, which is responsible for night vision, and also for the maintenance of normal mucosa, for the regulation of the gene expression, also for the normal reproductive system, normal reproduction, and it also has a antioxidant properties, and it is also a photoreceptive purposes, that is for same as like visions. So these are the main functions of vitamin A. Among these, the very important function is vision and regulation of gene expression, and also for the skin epithelium vitamin A is very important. So vitamin A is a fat soluble vitamin. It need a pancreas for the digestion. So if you take a vitamin A, it is in a ester form, and in the gut we have cholesterol esterase. This cholesterol esterase, what it do, it break this vitamin A ester into fatty acid and a free vitamin A. So this free retinol in the gut epithelium, it go to the blood. How? By the absorption. The re-esterification of this happen, and then it will get absorbed in the blood. After blood, it will go to the liver, and the liver in the liver it is stored in the form of retinyl ester. But vitamin A is a fat soluble vitamin, and blood is made up of plasmin, that is water, so it cannot be mixed, water and lipid. So vitamin A bind to the plasma protein, two plasma protein, RBP and RABP. RBP, that is retinol binding protein, and RBP is retinoic acid binding protein. And then after binding, it will go to the places where there is a need, like to the bones, teeth, eye, to the epithelium, and also to the reproductive system. And if we talk about the regulation of gene expression, it acts via retinoic acid receptors. So all trans retinoic acid and 9-cis retinoic acid are transported to the nucleus of the cell, bound to the cytoplasmic retinoic acid binding protein. So within nucleus, all trans retinoic acid bind to the retinoic acid receptor, that is RAR, and 9-cis retinoic acid bind to retinoic acid receptor RXR. So this is receptor which is RAR, retinoic acid receptor. So there are two receptors. The number one is RAR, by which the trans retinoic acid binds, and the next we have is RXR, by which 9-cis retinoic acid binds. So remember these two receptors, RAR and RXR. So RAR and RXR, they form a heterodimer which bind to a regulatory region of chromosome called retinoic acid response element rare. It bind to rare retinoic acid response elements, and binding of all trans retinoic acid and 9-cis retinoic acid to RAR and RXR receptor respectively allow the complex to regulate the rate of gene expression, or specifically we can say gene transcription. So this is how it regulates the gene expression. So next, let's talk about the clinical uses. It is used in a treatment of vitamin A deficiency in acne, acute PML, measles, hairy leukoplakia, and rhinitis pigmentosa. In case of acne, if it's a mild case, give topical vitamin A. If it's a severe cystic acne, give oral vitamin A. One thing I want to mention here, that it is teratogenic, so avoid giving in pregnancy. Never prescribe vitamin A to a female in childbearing age without a pregnancy test. Please guys, always remember this, note this, never prescribe vitamin A to a female of childbearing age without pregnancy test. So next we will talk about vitamin A deficiency. What is vitamin A deficiency? Low amount of vitamin in the blood, no amount of vitamin which is present in the blood. So vitamin deficiency we classify in two types. There are two types of vitamin deficiency. The one is the primary vitamin deficiency, and the next is the secondary vitamin deficiency. So the primary vitamin deficiency basically caused by the low intake of the vitamin if we are not eating, and the secondary is because of the normal there is a normal intake, we are eating, but the absorption is abnormal. So there are two examples of abnormal absorption, that is antivitaminosis and malabsorption syndrome. So in these two things there is a secondary vitamin deficiency. So what happen if there is a vitamin deficiency? We can see nectoplia, that is night blindness, metaplasia, keratinization, keratomalacia, bone and teeth problems, xerophthalmia, and if deficiency, infection. So what are the symptoms? There are bilateral dry eye, night blindness, biotic spot, corneal ulcer, dry skin, malabsorption of fat, cystic fibrosis, iron deficiency, and bone and teeth problems. Here are some pictures which I'm gonna show you guys. So the first picture here, this is a biotid spot due to the conjuncted keratinization, and this picture is keratomalacia, that is corneal degeneration, and this is pherinoderma. In the elbow we can see this small this is called pherinoderma. So next we will talk about hypervitaminosis. What is hypervitaminosis? Hypervitaminosis is usually seen in a people of Arctic region who are Arctic explorer. Why? Because the people there, they eat lot of liver of bear, so it is very much rich in vitamin A. So in acute cases we see pseudotumor cerebri, exfoliate dermatitis, hepatomegaly, and hyperlipidemia, and chronic cases we see nausea, vomiting, restlessness. It causes fracture because retinoic acid favors the osteoclastic activity. So what happen if the osteoclastic activity will be increased? Demineralization of bone happen, and because of the demineralization of the bone, it increases the risk of the fracture. So this is why the hypervitaminosis increase the risk of the fracture. So how we can check vitamin A deficiency? How we can assay the vitamin A? So the very first thing we can do is our dark adaptation time. We can check the dark adaptation time, and next obviously we can check a serum vitamin A, but we can check serum vitamin A by Carr and Price reaction. Remember the name, which is Carr and Price reaction. So let's talk about treatment. Before treatment, I would like to tell you about vitamin A supplements, how we can, and what vitamin A supplements we can give. So vitamin A supplement from the age group of 6 to 10 month of age, it is the requirement is for the 1 lakh international unit. We can give orally, that only once, and for the 12 to 59 months there is 2 lakh international unit, also orally, in every 4 to 6 month. So on an average, or we can say approximately, total dose of vitamin A should be given is 17 lakh international unit. So if we will talk about the approx dose we have to give is 17 lakh international unit. So now how we can give this 17 lakh international unit? How we can schedule this? So the first dose we have to give is 1 lakh international unit. This is given with the measles at 9th month. This is given with the measles vaccines at 9 months. Then we have to give the 2 lakh international unit with the DTP boosters at 15 to 18 month, and then again we have to give 2 lakh international unit given every 6 months till 5 year of age. Okay, so always remember 1 lakh, 2 lakh, 2 lakh, 1 lakh with the measles at 9 months, 2 lakh with the DTP at 15 to 18, and then 2 lakh in every 6 months. So if there is a deficiency, how to treat? Guys, deficiency of vitamin A mostly seen in pediatrics department. So if the age is less than 6 months, 50,000 international units, 6 to 12 month, 1 lakh, and if more than 1 year, 2 lakh international unit is required. Thank you so much for watching, guys. I think I have covered everything which is required for vitamin A. Please like, share and subscribe the video.